आज हम हमारे बारे में कुछ चर्चा करने वाले हैं। मैंने ये इसलिए कहा कि आई ऑल्सो बिलोंग टू योर ग्रुप, that is senior citizens group, because I am running 68. So we are all sailing in the same boat and we all are facing more or less similar problems. Actually मुझे ऐसा लगता है कि senior citizens ये गलत nomenclature है. Actually it should be experienced young members of society. We should be called experienced young members of the society. You know something, when I turned 60, I threw a party to all my friends, and one of the friends, उन्होंने मुझे एक तोहफा दिया, टी-शर्ट, और वो टी-शर्ट पे ये लिखा हुआ था, I am not 60, I am just 18 with 42 years of experience. So what I mean to say is that aging is a definite process, but feeling old is a state of the mind. और बुढ़ापे के काफी कुछ फायदे भी है, नुकसान भी है, हाँ, डिसएडवांटेजेस भी तो है, बट लेट अस फोकस ऑन द पॉजिटिविटीज. जैसा चाय मस्ती ग्रुप आपने रखा है, पॉजिटिव नाम है, तो लेट अस फोकस एट द पॉजिटिविटीज. मैं अभी की मिसाल दे रहा हूं, 2-3 दिन पहले की बात है. मेरा पासपोर्ट रिन्यू कराने के लिए पासपोर्ट ऑफिस में मुझे बुलाया गया था. 2 बजे की अपॉइंटमेंट दी गई थी. मैं वहां 2:45 बजे पहुंच गया और बड़ी कतार थी वहां पे. तो मैंने पूछा कि भाई क्या चल रहा है, तो मेरे सामने जो खड़े थे, मेरे आगे जो खड़े थे लोग, वो बोले कि भाई हमको तो 11 बजे की अपॉइंटमेंट दी गई थी, अभी तक कुछ काम हुआ नहीं. मैं तो चकरा गया, तो बोला अभी मेरा नंबर आएगा कब. तो थोड़ा सा हौसला बढ़ा के मैंने रिसेप्शनिस्ट के पास में गया और उनको पूछा, अरे भाई सीनियर सिटीजन्स के लिए कुछ अलग सी कतार है या नहीं आपके पास. बोला ना, बोली वो. थोड़ा परसुएशन करके ये करके मुझे उन्होंने आगे घुसा दिया, और बिलीव मी, आधे घंटे के अंदर अंदर काम करके मैं बाहर भी आ गया. तो ये एडवांटेजेस हमारे एज ग्रुप के हैं. सबसे बड़ा एडवांटेज क्या है मालूम है? जब हम कुछ काम भूल जाते हैं या तो कर नहीं पाते, किसी का नाम याद नहीं रहता, तो यू कैन ऑलवेज ब्लेम इट ऑन द एज. अरे भाई भूल गया, एंड यू आर एक्सक्यूज्ड. दैट इज द बिगेस्ट एडवांटेज ऑफ आवर बीइंग elderly citizens. बचपन, जवानी, मिडिल एज और बुढ़ापा, ये एक नेचुरल प्रोसेस है, ये कुदरती कानून है, इसे कोई टाल नहीं सकता. ये सीक्वेंस बराबर चलते ही रहता है. आज पर्टिकुलरली हम 2 चीजों के ऊपर बात करने वाले हैं. 2 टॉपिक्स है, एक तो डिप्रेशन और दूसरा है डिमेंशिया. सीनियर सिटीजन्स के साथ ये दोनों टॉपिक्स का काफी रिलेवेंस है. इन दोनों का काफी गहरा ताल्लुक है. उसके पहले कि मैं डिप्रेशन और डिमेंशिया के बारे में कुछ कहूं, नॉर्मल एजिंग क्या होता है ये समझ लेना बहुत जरूरी है. व्हाट इज नॉर्मल एजिंग? व्हेन वी टॉक ऑफ एजिंग और ओल्ड एज, बुढ़ापा, तो हमारे सामने एक तस्वीर खड़ी हो जाती है. कांपता हुआ बदन, दांतों का ना होना, अगर वो अभी तो डेंचर्स रहते हैं आजकल, पता नहीं चलता, लेकिन कम दिखना, कम सुनाई देना, रिंकल्स ऑन द फेस, सर पे बाल न होना, अगर हुए भी तो मेरे जैसे सफेद. आदि शंकराचार्य जी ने अपनी चरपट पंजरी में इसका यथार्थ वर्णन किया है, डिस्क्रिप्शन किया है. वो बोलते हैं, अंगम गलितम पलितम मुंडम दशन विहीनम जातम तुंडम. और आखिर में कहा है तदपि न मुंजति आशा पिंडम। आशा, अपेक्षा, अटैचमेंट्स, एक्सपेक्टेशंस, ये तो बुढ़ापे में भी छूटती नहीं है और बहुत सारी समस्याओं का कारण यही है। इसके ऊपर आदि शंकराचार्य जी ने एक इलाज भी बताया है। वो कहते हैं भज गोविंदम। अभी भज गोविंदम किसको पसंद आएगा, किसको पसंद नहीं आएगा, कुछ लोग करते होंगे, कुछ लोग नहीं करते होंगे, वो तो अपनी अपनी चॉइस की बात है। लेकिन कुछ हद तक समस्या हल करने का ये भी एक तरीका है, क्योंकि आशा पिंड जो है वो ऐसा नहीं कि बुढ़ापे में अचानक सा उभर आता है, वो तो जन्म से ही हमारे साथ रहता है, लेकिन बढ़ती उम्र के साथ साथ उसे थोड़ा थोड़ा कम करना हमको सीखना चाहिए। निराश रहना और आशा रहित रहना, इन दो चीजों में काफी फर्क है। निराश रहना यानी डिप्रेशन हो गया, और एक्सपेक्टेशन ना रखना, आशा रहित होना और फिर भी काम कर देना, ये दूसरी बात है। आपकी जानकारी के लिए एक रेफरेंस देता हूं मैं। आंद्रे मारवा करके एक इंग्लिश ऑथर है और उन्होंने आर्ट ऑफ लिविंग करके एक किताब लिखी है। वो श्री श्री रविशंकर जी के साथ उनका कोई ताल्लुक नहीं है, ये अलग सी बुक है, खाली टाइटल आर्ट ऑफ लिविंग है। और उसमें उन्होंने एक चैप्टर लिखा है हाउ टू एज ग्रेसफुली। अगर वो किताब आपको मिले तो जरूर पढ़ लेना। एक दो और भी चीजों का मैं जिक्र करूंगा, लेकिन वो जब when I come towards the end of my speech, I will definitely make a mention of other things. खैर, अब देखते हैं कि नॉर्मल एजिंग क्या होता है। 30 की एज से लेके 70 तक इंसान का जो ब्रेन रहता है वो 5% घिस जाता है, उसका वजन 5% कम हो जाता है। बाय द एज यू आर 70, योर ब्रेन इज 5% लेस इन वेट एज वेल एज इन फंक्शन। 70 से 80 की उम्र तक 10% और 90 की उम्र तक 20% कम होता है। हमसे अक्सर पूछा जाता है, वी आर वेरी ऑफन आस्क्ड, कि क्या बुढ़ापे की समस्याएं उसमें वृद्धि हो रही है, whether there is an increase in the incidence of problems of the old age। जवाब एक्चुअली सीधा सा है। The answer is very simple। आज से 70-80 साल पहले, जस्ट इंडिपेंडेंस, प्री इंडिपेंडेंस के बॉर्डर लाइन पे हम देखिए, 1940s में the average life expectancy of Indian human being was 40 years, 39-40 years। आज की तारीख में वो 70 हो गई है। और परसों ही अखबार में मैंने पढ़ा कि इन लास्ट 45 years it has increased 20 years। सो इस रफ्तार से लाइफ एक्सपेक्टेंसी बढ़ती जा रही है, तो आप अंदाजा लगा सकते हैं कि जीरियाट्रिक मेडिसिन या जीरियाट्रिक साइकेट्री ये मोस्ट रिसेंटली इवॉल्व्ड ब्रांच है। अभी तक इतनी उम्र तक लोग जिंदा रहते ही नहीं थे, तो काफी सारे इश्यूज जो आज हमको 70s और 75 और 80 की उम्र में दिखाई देते हैं, तब तक कोई बचता ही नहीं था ज्यादा, तो ऑब्वियसली वो इश्यूज बहुत कम थे। दूसरी बात तो यह है कि लाइफ एक्सपेक्टेंसी क्यों बढ़ी है, बिकॉज ऑफ बेटर न्यूट्रिशन, बेटर सैनिटेशन, better vaccination, antibiotics and other modes of treatment। फिर रिप्लेसमेंट थेरेपीज है, जैसे कहा मैंने कि भाई दांत अगर गिर गए तो आप टूथ इम्प्लांट कर सकते हैं या डेंचर लगा सकते हैं। अगर आंखों में कोई तकलीफ हो गई तो कैटरेक्ट जैसी सर्जरीज है। पहले जमाने में अर्लियर यू वुड हैव टू वेयर वेरी थिक ग्लासेस आफ्टर कैटरेक्ट सर्जरी। अभी तो अंदर लेंस बिठा देते हैं, खबर भी नहीं पड़ती कि भाई कैटरेक्ट सर्जरी हुई है। उसके लिए इलाज है। कानों से अगर कम सुनाई दिया तो उसके लिए हियरिंग एड्स है। गंजा हो गया तो हेयर इम्प्लांट है ना। अगर लिवर फेल हो गई तो लिवर ट्रांसप्लांट है। अगर आपकी किडनी फेल हो गई तो किडनी ट्रांसप्लांट है। अगर घुटने घिस गए तो नी ट्रांसप्लांट है, नी रिप्लेसमेंट सर्जरी है, हिप रिप्लेसमेंट सर्जरी है। रिंकल्स आ गई फेस के ऊपर तो कॉस्मेटिक सर्जरी है। ये इतने सारी चीजें है जिसकी वजह से लाइफ एक्सपेक्टेंसी बढ़ती जा रही है। बिकॉज ऑफ ऑल दिस टेक्नोलॉजिकल एडवांसेस इन द मेडिकल फील्ड, द लाइफ एक्सपेक्टेंसी हैज इंक्रीज्ड। सिर्फ ब्रेन के लिए अब तक कोई रिप्लेसमेंट आई नहीं है। ब्रेन का कोई ट्रांसप्लांट है ही नहीं। तो इसलिए विथ एडवांसिंग एज intellectual functions decline slowly. After middle age, they start declining slowly. जिसको हम AAMI कहते हैं, एज एसोसिएटेड मेमोरी इम्पेयरमेंट, वो धीरे धीरे दिखाई देती है। There is deterioration in short-term memory. There is slow intellectual thinking and slowness of movements. There is definite change in personality. The negative traits of personality वो ज्यादा बढ़ते हैं और attitudes become more rigid. अभी socially भी there are a lot of restrictions in our movements. There are less of social interactions. अगर आपने अपना जीवन साथी खो दिया है, if there is loss of spouse, then you become more isolated and lonely. Generally, children nowadays don't stay with the parents. They are either staying separately in the same city or town, or they are abroad. We call it empty nest syndrome. घरोंदे में से बच्चे उड़ जाते हैं, सिर्फ मियाँ बीबी रहती है। उसमें भी अगर मियाँ और बीबी में से कोई एक जन चला गया तो और भी ज्यादा आइसोलेटेड हो जाता है इंसान। विजिटर्स का आना जाना कम हो जाता है। फाइनेंशियल क्रंच बिकॉज ऑफ increased inflation, that is another concern. So all these things are bothering the elderly people socially. इसमें एक्सेप्शन खाली चाइना और जापान का है, जहां पे आज तक बच्चे अपने माँ बाप के साथ रह रहे हैं, और इन दोनों देशों में ओल्ड एज की समस्याएं काफी कम दिखाई दे रही। अभी जहां तक बुढ़ापे में या ओल्ड एज के लिए जो सर्विसेज है, गवर्नमेंटल सर्विसेज जो ऑफर की जाती है, there is a lot of difference. In advanced countries, there are a lot of facilities offered to the senior citizens because they are rich countries and they can afford. They have already taken care of roti kapda makan. हमारे इधर we have not been able to take care of roti kapda makan. तो आगे जाके बाकी का सब होता है कि ओल्ड एज प्रॉब्लम कैसे निपटा जाए या उनके लिए क्या क्या किया जाए। तो इसीलिए इंडिया जैसे डेवलपिंग कंट्री में ये समस्याएं ज्यादा गहरी दिखाई देती है। चलो अब हम बात करते हैं डिप्रेशन के बारे में। आप सबको पता है कि डिप्रेशन इज नंबर 1 किलर डिसीज, मच अहेड ऑफ कैंसर्स एंड कार्डियक इश्यूज आज की तारीख में। एंड दिस प्रेडिक्शन was done by WHO way back in 2000 because of the increased stressors of life. आज की तारीख में डिप्रेशन is number 1 killer disease, directly and indirectly. Directly, as a complication of depression, suicide. जितने भी सुसाइड हम देखते हैं, सबसे ज्यादा परसेंटेज सुसाइड का डिप्रेशन की वजह से होता है। और सेकेंडरीली, बिकॉज यू आर डिप्रेस्ड, योर फिजिकल हेल्थ ऑल्सो डिटीरियोरेट्स। यू टेंड टू निग्लेक्ट योर फिजिकल सेल्फ। टाइम टाइम पे, वक्त वक्त पे चेकअप करना, डॉक्टर के पास जाना, गोलियां लेना, ये सब कम होते जाता है। And self-neglect increases, as a result of which there are a lot of complications in physical conditions, and because of that, the mortality, the death rate increases. So all in all, depression is number 1 killer disease today. What is depression? In psychiatry, there are majorly 2 types of disorders: mood disorders and thought disorders. Schizophrenia वगैरह जो है वो thought disorder, primarily the thinking process is disturbed, that is schizophreniform disorders. And primarily where mood is disturbed, that is called mood disorder, or depression is a mood disorder. आज हम यूनिपोलर डिप्रेशन के बारे में बात करने वाले हैं। मैनिक डिप्रेसिव साइकोसिस या बाइपोलर मूड डिसऑर्डर, या कभी खुशी कभी गम, वो जो एक अलग सी डायग्नोस्टिक कैटेगरी है, उसके बारे में मैं नहीं बात करने वाला हूं। मैं यूनिपोलर मेजर डिप्रेशन के बारे में बात करने वाला हूं। डिप्रेशन एज अ रिएक्शन इज वेरी कॉमन। आप सबको मालूम है कि कुछ अगर नेगेटिव इंसिडेंट हो गया हमारे लाइफ में, तो वी ऑल फील डिप्रेस्ड, बट वी कम आउट ऑफ इट इन ड्यू कोर्स। अगर एग्जामिनेशन में फेल हो गया आदमी, या किसी की मौत हो गई, ओके, वी फील डिप्रेस्ड एज अ रिएक्शन, बट इट डज नॉट कंटिन्यू. When it continues for months, and when it interferes with your social, professional life, then it is called a disorder. So depressed mood, feeling low, negative, pessimistic thinking, lack of initiative, lack of enthusiasm, frequent crying spells, being over touchy, oversensitive, reduced energy, slowness of thinking and slowness of movements, poverty of ideas, loss of drive, loss of initiative, ideas of hopelessness, helplessness, worthlessness. These are the key features of depression. Body language से भी पता चलता है whether a person is depressed. Generally, the speech is reduced and monotonous, low tone, and the shoulders, they are drooping. The walk is very slow. There is no spark in the eyes. There are a lot of people with depression unnecessarily feel guilty. अगर कुछ नेगेटिव इंसिडेंट हो भी गया है फैमिली में, तो खुद को रिस्पॉन्सिबल समझते हैं। Because of me, this thing has happened. They curse themselves. That is called guilt feeling. Feeling bad is one thing and feeling guilty is another thing. After a negative event, feeling bad is a very normal, natural process, but feeling guilty is abnormal, and that leads to depression, that breeds depression. So it is very important that we should not feel guilty unnecessarily. नींद कम हो जाती है, या तो देरी से नींद आती है या जल्दी खुल जाती है. Reduced appetite, all gone feelings, जैसे कि कुछ दुनिया में अभी बचा ही नहीं है. Even a rich person will feel that how will I manage myself in future? There is hardly anything to sustain me. All gone feelings. Bleak future, self-neglect, suicidal ideas, sometimes suicidal acts. These are the key symptoms of depression. Many a times it is also associated with anxiety, agitation, restlessness. दूसरी एक बात यह है कि अगर कोई पॉजिटिव इवेंट लाइफ में आने के बावजूद भी अगर आपका मूड एलिवेट नहीं हो रहा है, तो समझ लेना कि आपको डिप्रेशन ने घेरा हुआ है. Even after hearing a good positive news, if your mood does not change, or if someone cracks a joke and you cannot laugh heartily, then that is a sign of depression. अगर हंसी आ भी गई तो ज्यादा ऑब्लिगेटरी रहती है, स्पॉन्टेनिटी नहीं रहती उसमें. Slowly, gradually, one withdraws oneself from outside world and goes into one's own shell. Decision making ability is reduced, as a result of which people generally procrastinate. आज का काम कल पे, कल का परसों पे. The work piles. The procrastination is another key feature of depression. And lot of somatic bodily complaints, particularly ये देखा जाता है elderly depression. They complain about body ache, joint aches, not that it is unreal all the time, but excessive focus on bodily functions. इसकी वजह से there are a lot of somatic complaints. पेट में दुख रहा है, गैसेस हो रहे हैं, कब्जी हो रही है, सर दुख रहा है, पीठ दुख रही है. आपने अमिताभ बच्चन वाली वो फिल्म देखी थी 5, 7, 8 साल पहले शायद आई थी, पीकू करके. हाँ, उसमें जो वो एल्डरली जेंटलमैन दिखाया ना अमिताभ जी ने, जो डिपिक्ट किया, बस वो that is a depressive picture. That is a typical self-centered, over self-focus, और खुद के शरीर के बारे में ही सोचते रहना. आज ये हो गया, आज वो हो गया, आज हुआ ठीक हुआ, कल होगा कि नहीं होगा. इस तरह की नेगेटिव एटीट्यूड. वेरी मच एप्रीहेंसिव अबाउट फ्यूचर, क्या होगा कल, क्या होगा. और memory, actually memory organically it is not affected. The person doesn't make efforts to recollect. See, dementia में भी memory affect होती है, लेकिन dementia में जब हम मरीज को पूछते हैं कुछ सवाल, तो we can see that the fellow is definitely making a lot of efforts to recollect. सीधा सा एग्जाम्पल है, अगर उनको वो नाम भूल जाते हैं काफी अक्सर डिमेंशिया में, वो मैं बाद में कहूंगा, अभी जाते जाते कहता हूँ. चाबी दिखाए उनको तो बोलेंगे हाँ हाँ हाँ, ताला ताला खोलते. क्या है, क्या ये पेन है? नहीं, पेन नहीं. पेंसिल? नहीं नहीं. छुरी है? ना, छुरी. चाबी है? यस, चाबी. So he is forgetting the things, but he is making an effort. He is trying to recollect. वो embarrassment उसके चेहरे पे दिखती है. Depressed person will not make an effort. Whatever you ask him, the answer will be, I don't know. I don't know. You can make out the fellow is not making an effort. So it is called depressive pseudo dementia. It is not actual dementia. तो इस डिप्रेशन में मेमोरी अफेक्ट इस तरह से होती है. Clinically, for psychiatrists, there are a lot of ways that we are differentiating depression: unipolar versus bipolar, mild, moderate, severe, neurotic depression where bodily complaints predominantly present, or a lot of anxieties are there, apprehensions are there. तो न्यूरोटिक डिप्रेशन होते हैं, साइकोटिक डिप्रेशन जहाँ पे कुछ हेलुसिनेशंस भी होती है, डिल्यूजन्स भी होती है, पर्सिक्यूटरी आइडियाज आती है. लेकिन उसमें भी एक फर्क है कि भाई वो जो इंसान रहता है, वो जो पेशेंट रहता है, he feels that he deserves every bit of it. If he is being persecuted, he deserves it. Reactive और endogenous depression ये अलग तरीके का क्लासिफिकेशन. When there is something bad that has happened with you, and as a result of that, if you go into depression, it is called reactive depression. In endogenous depression, the person comes and tells us, Doctor Saab, there is no reason why I should be feeling depressed. Everything is going my way. My children are asking me, yeah, they are looking after me. My wife is very kind and courteous. She's taking care of me. Financially, I have no issues. लेकिन अंदर से खुशी नहीं. I don't know why, but I am not enjoying life. I am not feeling happiness. वो endogenous depression. और उसका ताल्लुक कुछ केमिकल्स के साथ है. ब्रेन में कुछ केमिकल्स रहते हैं, डोपामिन है, सेरोटोनिन है, नॉरएपिनेफ्रिन है. तो वो केमिकल्स की कमी होने की वजह से डिप्रेशन मैनिफेस्ट होता है. बेसिकली इन साइकियाट्री वी बिलीव इन बायोसाइकोसोशो कल्चरल मॉडल. उसमें बायोलॉजिकल फैक्टर्स भी रिस्पॉन्सिबल है, जैसे आपकी जेनेटिक्स है, फैमिली हिस्ट्री है, पर्सनालिटी है, साइकोलॉजिकल इश्यूज है, सोशल एंड कल्चरल फैक्टर्स है. सो साइकियाट्री में हम बायोसाइकोसोशो कल्चरल मॉडल में बिलीव करते हैं. bereavement after a loss of a near and dear one, all of us feel depressed. Initially there is total numbness of emotions, then there is a state of denial, then there are spells of repeated crying, diminished sleep, diminished appetite. Sometimes there is feeling of guilt, but we come out of these things in due course. Depression में वो नहीं होगा. Oh. There is something called secondary depression also, particularly relevant to the old age. I've been told just now that you would prefer more of English. Okay, fine. I'll switch over to more of English. So there is something called secondary depression. The primary cause is some physical problem. For example, a person who has been having high blood pressure and has been on antihypertensive medicines. There are certain medicines which are used in cardiology, like some antihypertensive medicines, some statins which are used for reducing the cholesterol. They can cause depression. Long-standing diabetes, long-standing rheumatoid arthritis, all these chronic medical issues can cause depression. Such depression is called secondary depression. You treat the underlying physical cause and also give antidepressants, and the person comes out of it very fast. There are certain viral infections like flu and herpes, and recently we have all experienced corona. Post-viral infection, depression is very, very common. Then there are certain endocrine glands like thyroid dysfunction, hypothyroidism can lead to depression. Parkinson's disease can lead to depression. Paralytic stroke can lead to depression. Steroids, which are given in certain medical conditions, that can lead to depression. Diuretics leading to electrolyte imbalance can lead to depression. Anemia can also manifest as depression. Certain vitamin deficiencies are also responsible for depression. This is secondary depression. As I said, all these factors lead to depletion in certain chemicals in the brain, what we refer to as neurotransmitters. The main neurotransmitters that are responsible for depression are serotonin and norepinephrine. What is the complications of depression? I told you, self-neglect leading to complications in pre-existing medical disorders, and the worst complication is suicide. Believe me, all these things can be prevented. We are not dealing with cancer or something very serious. Depression is a perfectly treatable disorder. Unfortunately, there is a lot of hesitation on our part, particularly in our society, because of so-called social stigma, which is diminishing now. So we must accept the fact that there is something wrong with our mind. We take pride in saying that, oh, I had a heart attack and I underwent bypass. We will show the reports to all our near and dear ones, visitors also. We are ashamed of saying that, oh, I am not feeling up to the mark, I am feeling low, I am feeling depressed, I cry very often, I have become a little more sensitive. There is nothing to hide about your mental problems. The classical example is Deepika Padukone. She underwent depression. She had depression. She underwent treatment. She came out of it. And she publicly announced that, yes, I was depressed. And with treatment, I have come out of it. Today, Deepika Padukone is the brand ambassador of Indian Psychiatric Society. So, don't hide your depression. Log kya kahenge? Don't think about that. There's a saying, सबसे बड़ा रोग क्या कहेंगे लोग? Don't be ashamed. Come forward for treatment, and there is effective treatment for depression with various types of antidepressants, which are very effective. There are various types. I need not go into the details because of constraint of time. But let me assure you, the effective treatment modalities are there, and treatment depression is a perfectly treatable condition. There may be recurrences, particularly if you drop the treatment halfway or on your own you stop treatment against the advice of your physician or psychiatrist. Don't do that. What I'm going to say now applies to depression and also to a certain extent, to a great extent, as far as dementia is concerned. As far as depression is concerned, as I said, the drugs are same which are used in healthy in young adults. In young adults, the drugs are seen. Only thing is that considering the slowing of metabolism, we need to start with a small dose. So start low and go slow should be the policy. Treating the underlying cause is very, very important. As far as dementia is concerned and depression is concerned, encouraging mobility is very, very important. So physiotherapy plays a very important role as far as these things are concerned. Supervision of the drug intake is also very important. Don't leave it to the elderly person. Not that you don't believe in him, but many a times they either forget to take the medicine or they forget that they have taken the medicine and they take another dose. So supervising, and better than that, dispensing the medicines and making sure that the person is taking the medicines is very, very important. Supportive psychotherapy and reality oriented therapy is also very important. Another important thing about dementia as well as depression is support for the relatives, because they are the ones who are maximally taxed when an elderly person or family is ill. So as doctors, it is our responsibility to spend adequate time with the relatives, explain to them all these things in a nice, detailed way, give them a lot of reassurance. And whenever possible, particularly in case of dementias, there are a lot of support groups which are meant for the caregivers because they are maximally taxed. There is something called weekend admissions or holiday admissions so that the other family members can enjoy their weekend. There is something called daycare centers, particularly in the Western world. We don't have that much of facility in our country as of today, but it is happening slowly, gradually. Now let us move on to dementia. What is dementia? Dementia is an acquired global impairment of intellect, memory, and personality without impairment of consciousness. That is very, very important. There are multiple reasons. Mainly, there is significant loss of neurons and volume of the brain, particularly those regions of the brain which are devoted to memory and higher mental functions. Then there is deposition of certain abnormal proteins like amyloid proteins, which happens in Alzheimer's type of dementia. Neurofibrillary plaques are also seen. There are basically two types of dementias: treatable and reversible dementias, and non-treatable irreversible dementias. Now, treatable dementias are vascular multi-infarct dementias, dementias which are caused because of some tumors in the brain. You remove the tumor, the person recovers. There are certain metabolic conditions which can lead to dementia, like hepatic failure or renal failure, kidney failure. That may lead to metabolic dementia. Endocrine disorders like myxedema or Addison's disease or hypothyroidism can lead to dementia. You treat the underlying condition, the dementia is automatically taken care of. There are certain infections like AIDS, meningitis, encephalitis that can cause dementia. There are certain toxins, alcohol, heavy metals like lead or arsenic that can cause dementia. You eliminate those toxins and the person recovers. Anoxia or inadequate oxygen supply to the brain. It happens when there is severe anemia, because in anemia the hemoglobin levels go down, and hemoglobin is something which carries oxygen from the lungs to the various organs including brain cells, and brain cells require maximum oxygen. So when you have severe anemia, it can affect your brain cells, leading to dementia. For the same reasons, chronic pulmonary insufficiency or pulmonary respiratory failure can lead to dementia, which can be reverted if you treat the basic condition. Vitamin deficiencies like thiamine, B12, folic acid, D3, nicotinic acid, these can cause dementia. There is something called normal pressure hydrocephalus that can also cause dementia. You treat the cause, there is a surgery which is done, a shunt is created, and dementia reverts back. Subdural hematoma can lead to dementia. Again, treatment of subdural hematoma and the dementia is reversed. Then there are certain untreatable, irreversible dementias. Senile dementia is one such thing. Alzheimer's type of dementia, which is one of the most common dementias, it is irreversible. Yeah, there is no specific treatment. There is slow downhill course. There is something called Pick's disease, in which there is major degeneration in the frontal, prefrontal, frontal lobe and the temporal lobe. Huntington's chorea, Parkinson's disease, punch drunk syndrome. In boxers, they get repeated blows on their heads, leading to micro bleeds and micro infarcts. That can lead to dementia. Then there are, two types of dementias based on the findings: cortical type of dementia and subcortical type. In cortical type of dementia, brain, the outer part of the brain is all gray cells. When that degenerates very fast, it leads to memory lapse and language problems and thinking. And then when the underlying white matter degenerates faster, that leads to emotional disturbance, movement problems, and memory.
तो इसमें 800 कैसे होगा फिर?
Deterioration in mood and personality. These are psychological symptoms of dementia. There are sudden mood swings, and what we call the mood is very labile. Personality changes, the person becomes more impulsive, more aggressive, more impatient. Behavioral changes like disinhibitory behavior, socially unacceptable acts, wandering, agitation, aggression, confusion. These are the things which are seen in dementia. What are the warning signs? Memory loss, difficulty in performing familiar tasks like wearing the clothes, buttoning the shirt, tying the pajama. These very basic familiar tasks are also found to be, not happening. Problem with language, I gave the example of a key. You don't get the appropriate word, which is known as nominal aphasia. That happens in dementia. You struggle for the right word. The language is affected. You struggle for the right words. Then disorientation in time, disorientation in place. The person doesn't know where he is. Disorientation in space, that also happens. If your kitchen is on the right side of your bedroom, particularly in the night when the visual cues obliterate, then you tend to enter on the wrong side. The kitchen is on the right, the toilet is on the left. Thinking that you are entering the toilet, you enter the kitchen, void urine. The relatives feel that it is being done deliberately. No, it is not being done deliberately. It is because of loss of sense of, direction. Another area where a lot of misunderstanding happens is that these people remember the remote past, but they don't remember the recent things, because recent things are not registered. Whatever is not registered cannot be recalled. So they tend to forget the names of the daughters-in-law or the grandchildren, but they will remember the names of their childhood friends. And that leads to a lot of misunderstanding on part of the daughters-in-law. The old lady or the old man is doing it deliberately. It is not so. Whatever is written first is erased last, and whatever is written latest, it does not get written. There is no registration of the recent events, so there is no question of having recall. Okay. Misplacing things like mobile, remote control, chashma, spectacles, dentures, that happens. Changes of mood and behavior, that happens. Changes in personalities, as I said. Loss of initiative, loss of control over urine. These are the things that happen. Diagnosis can be made on the basis of certain psychometric tests meant for judging the memory of the person. But if you want a definite diagnosis, MRI or PET scan is the right investigation. You can get the exact degree of degeneration of the brain. As I said, there is no treatment in early dementia. Sometimes acetylcholinesterase inhibitors. Basically, dementia seems to be happening because of paucity of acetylcholine in the brain. So acetylcholinesterase inhibitors like donepezil, there are certain nootropics like piracetam, memantine. There are certain Ayurvedic things like ashwagandha and shatavari and brahm. They are all known to be, helping to a certain extent. But let me tell you, at the best, they slow down the process of further deterioration. They don't reverse the things. So, taking care of the affected person is the main task, and the burden is on the relatives. So, anywhere in the world you will see there are programs more centered towards or for the health givers, the health, the caregivers. That includes nursing staff, that includes relatives, because they are maximally stressed and they are maximally taxed. What we can do for them is keeping the things very simple, keeping all the hazardous objects away from them. Glasswares, they should not be allowed to use the electrical gadgets. They may keep the geyser on, they may keep the gas on. So don't allow them to do such things. Tell them one task at a time in clear and few words, very loudly and clearly. Easy to wear clothes. That's another way of, helping them. Let us come to the end of the presentation. There are 12 ways. There are many ways. I have just brought them down to 12 to keep your brain healthy. How to prevent dementia to a certain extent. Constantly stimulate your brain with puzzles and games and new inputs. Physical exercise an absolute must. Proper diet, sattvic ahar, lots of fruits and lots of vegetables. Vegetarianism is known to be, more advisable. The research is still on, but they say that non-vegetarian people are more prone for dementia. So, lots of fruits, lots of vegetables, sattvic ahar, adequate sleep, learning new things like language, switching the routine, change the habits, it will surprise your brain and it will turn off the autopilot. So be flexible in your routine. Avoid head injuries by using helmets, seat belts. Avoid other injuries also which will lead to falls. Be social. That will reduce your depression, and also social interaction will definitely help you being in the mainstream. Manage stress by doing relaxation, yoga, indulging in music, singing. Read books, avoid alcohol, drugs, and smoking. And digital detox, that is also very, very important. Too much of screen time affects sleep and overwhelm the brain. Generally, be active in life. Professionals are known to be less affected by dementia because they generally don't retire. Retired people who have not planned their post-retirement life, they are the ones who fall prey to dementia more because they stop using their gray cells. As I said, I will mention certain books and certain movies also for your better understanding of dementia and depression. The two films that come to my mind as far as dementia and depression are concerned, they are Marathi films, but they have subtitles, produced and directed by Sumitra Bhave and Sandeep Suktankar. And Mohan Agashe has acted in both these films, wonderful films. Kasav is the film, the turtle or tortoise. That is about depression. And Astu, let it be. Astu means let it be. That is for dementia. In both these films, Mohan Agashe has acted beautifully, and you will get a good insight into what depression is all about, what dementia is all about. Thank you so much. I end my talk over here. And before I do that, I will read out a poem which is in Hindi. I don't know whether you will. I suppose you should be able to understand. I came across this poem just a couple of days ago. Somebody posted on the WhatsApp. I'm ending my talk by reciting that particular poem. The title of the poem is अब हम छोटे हो गए. अब हम छोटे हो गए क्योंकि हमारे बच्चे बड़े हो गए. ऐसा मत करो, वैसा मत करो, ये खाया करो, वो खाया करो, दिन भर टीवी मत देखो, आंखों पर असर पड़ेगा. कभी आंगन में ही घूम लिया करो, बच्चों से ही सीख लिया करो. अब हम बच्चे हो गए क्योंकि बच्चे हमारे बड़े हो गए. अब तुम्हारी उम्र बढ़ रही है, बचपना छोड़ो, जिंदगी ढल रही है. समझदारी की बातें किया करो, सबसे ज्यादा मत बोला करो. हाँ में हाँ मिलाते हैं, जैसे सब कुछ सीख जाते हैं। अब हम छोटे हो गए क्योंकि बच्चे हमारे बड़े हो गए। जो काम कर पाओ वही किया करो, नहीं बनता किसी से कह दिया करो। यह सब करने की उम्र नहीं तुम्हारी, कुछ बातें मान लिया करो हमारी। कहीं चोट लग गई तो क्या होगा, बिन बात के लफड़ा होगा। अब हम छोटे हो गए क्योंकि बच्चे हमारे बड़े हो गए। खींच जाते हैं कभी कभी, जिद में रूठ भी जाते हैं कभी कभी, पर जल्दी ही मान भी जाते हैं। मीठा देख ललचा जाते हैं, क्या करें जाए भी कहां, अपने तो अपने ही होते हैं। यही सोच फिर जुट जाते हैं। अब हम छोटे हो गए क्योंकि बच्चे हमारे बड़े हो गए। थैंक यू।
Excellent, excellent.
Yeah, is there any questions? Please ask. Please feel free to ask questions.
Yes, sir. May
I want to
speak?
ask one thing.
Yeah.
I will raise my hand.
Fantastic session. Fantastic session.
Thank you.
We enjoyed, sir. Very informative.
Thank you.
I want to ask something. Hello, Dr. Ajit.
Yeah.
This dementia
Dr.
and
Ajit.
depression is something doing with the neck nerves. Nerves in the neck. Yes.
Not depression, dementia, yes, to a certain extent. Atherosclerosis of the carotid arteries can reduce your supply, blood supply to your brain, and that can cause dementia. That can.
So neck
But-
nerves are very painful, very much painful.
Nerves of the neck.
Neck, yes.
That could be because of cervical spondylosis, madam. That could be because of cervical spondylosis.
Mhm.
That's a different disorder.
Okay.
Because of the degeneration of the intervertebral disc. There are 7 vertebrae in the neck.
Neck, yeah.
And, yeah, in between the vertebrae, there is a cushion, which is known as intervertebral disc. When that gets degenerated, so, the nerves which are coming out from the side of the vertebral column, they get compressed. That leads to either numbness or pain, shooting pain. Yeah, that is called cervical spondylosis.
Cervical, yes, yes.
Yeah.
And is there any exercises for it or any medication? No. There is
There are medicines, there are, procedures like traction, wearing a collar. I mean, that is
that
in the realm of orthopedics, neurology. I am a psychiatrist. I don't deal with that, but I know the basics. I can tell you that using a collar, stretching,
Yes.
at times they apply traction.
Yes.
Yeah.
Yes,
Then
Thank you, Dr. Ajit.
they tell
Thank
you
you very much.
certain exercises.
Dr. Ajit, I am Kumar from Chennai. I am Kumar from Chennai. I just want to confirm whatever that you have said, which I experienced with my father,
Uh-huh.
who was 95 when the COVID was setting. He was not affected by COVID, but he felt withdrawn by not people visiting him, or he could not go out. And slowly he was affected by this dementia or whatever it is, which we could not understand initially.
Right.
And whatever that symptoms that you have told were there for him, and we were just mistaking him for something else. Ultimately, when we realized, when we took him to the doctor, the treatment was began. And we could not just tolerate the way that he was treated in the hospital. Because of that, we just got him out against the medical advice. But we thought that it is enough. He has just lived 95 and he should just die with respect. And actually, he was taking care of an orphanage and home for the aged and everything. At that age, he was busy. So it's actually, we allowed him to just lose his life. That was it. Actually, we could not just get him, recover him from that dementia. but he slowly just ended his life.
Many a times it so happens, you know, that
Yeah.
so long as the car is running,
Yeah.
there is no issue, even if the car is on. But once it stops, then there is a lot of problem restarting the car,
Yeah, yeah.
particularly when it is old.
Yeah.
So
Doctor, can I?
it requires some sort of trigger, and in your father's case, probably COVID, it acted as a major trigger.
Yeah, he was not affected by COVID, but the situation around him.
Yeah, yeah. So social causes,
Yeah,
and
yeah.
as I said, COVID is an infection. So any infection, particularly, you know, viral infection, it can lead to secondary depression.
Can I, Doctor?
I
Ask you a
am
question?
Ravi.
Doctor,
My wife,
I
Dr. Saab,
want to ask doctor, memory loss is called dementia. Just I want to know.
Astu.
The memory loss is
Uh-huh.
called dementia.
Yeah, one of the major symptoms of dementia is memory loss.
Okay, okay, okay.
There may be
Doctor, for insomnia,
sorry.
doctor, for insomnia, there is any?
As I said, insomnia is a symptom many a times. Primary insomnia is very rare. So you treat the underlying cause. There are certain sedatives, there are certain hypnotics. Which
I'm taking for last 10 years 81 2 mg. But there is no other problem. But I don't get sleep. Without that, I just can't get sleep.
If for last 10 years you have been on 81 2 milligrams, you are not required to increase the dose, it is no issue.
Okay,
No
thank
issue.
you, doctor.
No
Thank
issue.
you.
But then there are certain other measures which can be tried out. Leisurely walk after your dinner.
my wife is suffering from dementia as well as this Alzheimer's since 3 years. So I am taking the treatment of Dr. P.P. Shaw as well as Dr. Tushar Roth at present. So I want to know what suggestions you suggest. They have given the medicine, they were made 3 mg as well as Augmenta since 3 years.
That is memantine,
But
I mentioned.
no improvement I have seen.
As I told you, at the best, they can slow down the further process of deterioration. There is no reversibility of the symptoms.
Right.
Yeah. And you are in the best hands. You mentioned the name of Dr. P.P. Ashoka, if I heard it correctly. Yeah,
Right.
you're the best neurologist. So you're in the best hands.
Right.
Always advice. Yeah.
Right.
Doctor, I have two questions. One is I recently came across about some research on this dementia and Alzheimer, where they were saying that taking 1 spoon of coconut oil helps in these cases. Is it true? Taking 1 tablespoon of coconut oil helps in keeping the memory fine. That is one thing.
It
And
is, yeah, as I said, all these measures are more for prevention, not for
okay,
yeah.
treatment. Okay. And one more thing is you were saying about insomnia. I just want to know whether sleeping too much or eating too much also could be a symptom of depression. A person who takes breakfast and then goes for sleep, again lunch and goes for sleep, and whenever he gets time, gets into the room and starts sleeping. Or when he eats too much now. Like earlier used to be different and now he takes too much. This could be a kind of a symptom for depression.
Yes, yes. Because of, constraint of time, I could not go into details of atypical depression and things like that. But yes, what you said is absolutely true. Generally, the appetite is less and the sleep is less. But in atypical depression, the reverse happens. the increase in sleep and appetite or eating more, that is seen as a symptom of depression. There is something called masked depression also. And because of constraint of time, I could not go into the details of that, but what you say is absolutely true. Yes, as an uncommon symptom, yes, increase in appetite can happen.
In such a situation, what we are supposed to do?
Particularly in middle-aged women.
Yeah, correct.
Postmenopausal,
Yes.
sudden increase in appetite that and sudden weight gain. There could be underlying depression. There could be
But at this point of time, we have to seek medical help or not?
they should.
Okay.
Yeah.
Right. Thank you, doctor. Thank you so much.
Thank you.
Doctor, I am Sharda Mani from Bangalore. Doctor, you told that two films, which is Marathi and I want to know again. You can repeat that two films.
Astu is one film that is depicting dementia. Astu.
Another one.
And the other one is Kasav. Kasav means turtle, tortoise.
Oh.
Kasav.
Kasav. And another one you told that Amitabh Bachchan's film one.
Pinku. Piku.
Oh.
Yeah, and if you want to be a little more positive, don't see these.
I'm very fine. I'm very fine. I want to see that.
Have you seen Shaukin?
No, I'm Kannada. I'm Kannada in Bangalore. No, but I can understand.
It's a good film in that, Ashok Kumar, who is the other one? I think Utpal Dutt, Ashok Kumar, Utpal Dutt, and A.K. Hangal.
A.K. Hangal.
A.K. Hangal, Ashok Kumar, and Utpal Dutt.
Rati Agnihotri.
Beautifully, and that is the positive side of old age. So see that film also. Shaukin. It's a good film.
Oh, that Piku, na? Piku. Yes.
Piku is by Amitabh Bachchan.
Okay. Yeah, Deepika Padukone and Amitabh Bachchan.
Yes.
Let us not run into discussing films, please.
Yes.
Sir, may I ask
I
a
want to
question?
note down that one.
Mr. Raman, we'll take your question last and then we have to conclude.
I'm being told that we are running short of
Okay.
time. We have already
Okay. I would just ask, you please give us some tips how to combat depression, because I lost the internet connection and missed a part of your lecture. I'm very sorry about that. Please enlighten me as to how you combat depression as briefly as you could, please. I'm sorry.
How to overcome depression?
Yeah. You see, I have some depressing thoughts. Even Russia-Ukraine war depresses me.
You have to accept it and seek medical help. You can visit your nearby psychiatrist and he will give you appropriate medicines. Alongside, there will be some supportive therapy also, psychotherapy. All in all, the antidepressants and psychotherapy that will help you come out of your depression. Definitely. So seeking medical help, psychiatric help is important and essential.
Thank you so very much, everyone. Thank you, Dr. Dandekar.
Thank you,
We have
Doctor.
overshot this thing, allotted time.
Yes.
Thank you, Doctor.
We come to an end over here.
Yes, thank you so much for your time and for enlightening us, for answering the questions. And also thank you to Kaushal Sethia ji for organizing this session for us and helping us, the best way he could. So thank you to both of you. We really had a very nice and informative session. So with that, we'll conclude. So have a great evening, everybody. Bye.
Thank you.
Thank you, doctor.
Thank you.